The World Health Organization, on behalf of the COVAX Facility, has initiated a no-fault compensation program to address issues of side effects as a result of administering the COVID-19 vaccines. Today on Sound Health, we'll look at what the initiative entails. I am Olasunbo Mudupe. Welcome. We begin with COVID-19 updates. AstraZeneca says a review of its data found no evidence that its vaccine against the coronavirus causes blood clots, the same day that Ireland and Netherlands joined a growing list of countries that are suspending the use of the shot. The review covered more than 17 million people who had received the vaccine in Britain and other European Union countries. Denmark, Norway, and Iceland have also suspended the use of the vaccine because of clotting issues. Austria stopped using a batch of the shot last week while investigating a death from coagulation disorders. Ireland's Deputy Chief Medical Officer Ronan Glynn Sunday explained that though there was no conclusive link between the vaccine and incidents of blood clots, he would recommend suspending the use of the shot as a precaution. His recommendation followed Norway reporting 4 cases of blood clots in adults inoculated with the AstraZeneca shot. In addition to the company itself, the European Medicines Agency and the World Health Organization have said there is no indication the clotting events were caused by the vaccine. Lagos State Ministry of Health says about 250 persons have been vaccinated in the state. They are frontline healthcare workers. According to the ministry, there are no major adverse effects recorded other than the expected injection site pain, body pains and chills lasting 24 to 48 hours in some. Frontline workers, health professionals, security agents, and first responders are urged to register online at vaccination.gov.ng/public-reg or visit the Infectious Disease Hospital, Yaba, Lagos State University Teaching Hospital, Idiaraba, Lagos State University Teaching Hospital, Ikeja, or the Federal Medical Center, Ibutemeta, to get the shot. New confirmed cases have been recorded in Nigeria. Till date, over 160,000 cases, about 145,000 discharges, and 2013 deaths have been recorded in 36 states and the Federal Capital Territory. Globally, there have been more than 119.4 million confirmed cases of COVID-19, including 2.6 million deaths reported to WHO, while above 304 million vaccine doses have been administered. Thanks for staying with us. The World Health Organization No-Fault Compensation Program is for 92 low-middle-income countries and economies. Dr. Cyril Erameh is joining me on the show to discuss the program. He is the Director, Institute of Lassa Fever Research and Control. Dr. Erameh is also a consultant physician and neurologist with Irrua Specialist Teaching Hospital, Irrua, Edo State. Thanks for staying with us, Dr. Erameh.
Thank you.
Okay, Dr. Erameh, it is the first of its kind. Is there actually need for the compensation program by the World Health Organization?
Yes, there's actually a need for the compensation program because it's going to alleviate the time delays that could ensue with litigation following vaccine administration. It's not a new thing that persons react to vaccines, maybe with some adverse events, and sometimes people might seek judicial solutions to that, and that can delay the process of vaccine administration and vaccine distribution. And if issues, legal issues start to come up concerning any vaccine, it also deters the public from receiving that vaccine. So the no fault compensation tries to remove that gap, in that if you just if there's any adverse reaction related to the vaccine, you are compensated without any legal action. So it will be of use to improve the spread of the vaccine to people that need it.
Tell us, Dr. Erameh, what does this entail?
The compensation.
Yes, the compensation program. Yes, what does it entail?
Yes, it's a compensation plan which is from a tax levy, a bit of it from those costs, and then there are also some insurance cover on it, which are still being worked up by WHO and a company called Jobs, who is dealing with the insurance part of it. And this compensation, which is to commence on the 31st of March, should span to June 2022, by when a lot of the planned vaccines spread will have gotten to almost the whole part of the world. It's the first of the kind, as you have said. There has been no international compensation plan for any vaccine before. But looking at the nature of the current pandemic, the vaccine is going to span through the whole of the world, and so this plan is to assist persons who end up having adverse effects from the drug, from the vaccine, who will have under other circumstances sued for compensation. So if you develop any adverse effects from these vaccines under the COVAX program, you will be compensated with a good sum immediately.
Okay,
and then the compensation plan, though it will start in March 31st, will also cover persons who have had the vaccine under that program before March 31st.
Okay. With your response now, what form of injury are we looking at? Aside from side effects, are these deformities? Because we know body systems differ.
Well, only side effects have been recognized from clinical trials concerning these vaccines, particularly the vaccines that have been shipped under the COVAX program to Nigeria. They are the only serious side effect, though it has not been seen in any persons, but it's a common side effect to any vaccine, is an anaphylactic reaction. That's why the vaccine has to be given in a medical condition where if such reactions occur, that they are taken care of. And then if anybody gets this vaccine, he has to wait 15 minutes in the medical place center where he gets the vaccination to check for any anaphylactic reaction. Aside those anaphylactic reactions, there are no other anticipated side effects that are unusual from this vaccine. So concerning deformities, there is no such report of the vaccine causing any deformity or particular injury.
Let us consider the fact that they were authorized for emergency use. Should there be a compensation plan?
Yes, there should be a compensation plan in case of any injuries. As I said, the chances of having these injuries are very low, but you can never say never. But in case not the injuries, in case of any reaction that is serious, a serious adverse effect of a vaccine, in case any of that happens, it's good to have a compensation plan which should be disbursed as soon as possible. I think it's a better plan than any other thing.
Okay, does this plan cover vaccines that are not under the COVAX facility?
As much as the WHO interim guideline report says, it doesn't cover vaccines that are not on the COVAX program, because the COVAX program that is covering this compensation plan.
I understand the federal government is also partnering with some institution on vaccine production. And do you think the World Health Organization will accommodate such vaccines under the COVAX initiative?
Yes, if those vaccines are properly tried, if they pass the human trials and then the results are analyzed by the WHO, and the WHO deem fit that those vaccines are efficacious enough, they can be included to the COVAX program, particularly if they are easily accessible, cheap, and able to be useful in low resource areas. So I think if we get those kind of vaccines produced, it could be included.
The program is funded by a small levy on each dose supported by the Gavi COVAX AMC. Many have said rather than task levy on each doses for the compensation plan, the cost of a dose should be subsidized further for low-income countries. Do you share a different view?
I share a different view. The doses of if you know what it takes for vaccine production, particularly expedite vaccine production, the cost of the vaccines are good enough. I think the plan for putting a small levy on the doses to work for compensation, I think it's a better plan than reducing the cost of the vaccine. It might be very difficult reducing the cost of these particular vaccines because they're already cheap. 5 times cheaper. So I think the cost has already been built into this vaccine, and then reducing it further might not be feasible.
Dr. Erameh, let's look at vaccine dosage and efficacy. Can you please confirm what brand of vaccine is in Nigeria?
The brand of vaccine in Nigeria is the AstraZeneca Oxford vaccine, also called AZ1222, long name. The dosage is 0.5 mils, given intramuscularly in the deltoid and given after 4 to 12 weeks. But WHO recommends 8 to 12 weeks interval between the first dose and the second dose. The overall efficacy is about 63.09%, but efficacy after the first dose in some studies have been as high as 90%. So I think at this point where we really need to stop this pandemic, I think it's efficacious enough for use, particularly in special populations that need this vaccine.
How far apart should the doses of COVID-19 vaccines be? We know in other clients, because of limited stock, the second dose is delayed.
Well, that's not entirely true. The space between dosage is not because of limited stock. I don't know where that information comes from, but information from studies have shown that a bit of a delay between the first dose and the second dose increases the efficacy because it's something related to immunogenicity of the vaccines. It stimulates immune antibody production, which adding a second dose too early might not change that stimulus, but there has been shown by studies that, for example, the vaccine we use in Nigeria now, delaying for up to 12 weeks can improve the efficacy. So the delay in giving the second dose is not because of limited stock, but it's because that the longer between the first dose and the second dose, the more the efficacy after the second dose.
Okay, thanks for the clarification. What if I miss my second dose? Does it change anything?
Well, you have to get the second dose within 4 to 12 weeks after the first dose. A dose after 12 weeks might not be encouraged because at that point you will have had enough immune response and might not need it immediately. So it shouldn't be missed. Or if you can miss, you should give a window between 8 to 12 weeks. After 12 weeks, I can't tell if it's studies have not proven if there's a much change of you missing your drugs, your vaccine. So I can't speak categorically on that.
Dr. Erameh, tell us, is it safe to get 2 doses from 2 different manufacturers?
According to the interim guideline of WHO published in February 10, 2021, which is WHO is the body that handles all these vaccines for COVID. You cannot use 2 vaccines from different manufacturers as of now, until further information allows that. So for now, you can only have the same vaccine from the same manufacturer for the 2 doses.
Let us know what, I'm sure viewers will want to know what vaccine efficacy is all about. What is vaccine efficacy and why is it so important at this time?
So to simply put, vaccine efficacy tells how much the vaccine can prevent you from having the infection for which you are being vaccinated. So clinical trials tries to look at that, either quantitatively or qualitatively. Quantitatively, we mean looking at the response of antibodies, neutralizing antibodies to that infection. How high does it get after the vaccination? Or qualitatively, it looks at whether you have the disease after being vaccinated. So it's those chances that are given out as figures to show the percentage efficacy of a vaccine. So the higher the percentage efficacy of a vaccine, the more it will be that the vaccine can protect you from the disease.
Can I easily compare the efficacy of different COVID-19 vaccines?
The efficacies are online. You can check for them, but depending on whatever vaccine you're interested in. They are not hidden information. They are all outcomes of clinical trials.
Okay, I want to ask you this question now. We all know the country just got a delivery of the AstraZeneca vaccine, and I'm sure some governors, some states are also sourcing for more vaccines. Do you think there will be different brands from the AstraZeneca vaccine? And is it ideal to do that, to source a different brand now?
Well, there's a program for vaccine supply to countries. Nigeria is among the 92 eligible countries for this program, which is the COVAX program. So, and I think the Minister of Health also stated clearly that vaccines will be distributed properly through a particular channel. So I don't think any state governor or anybody, and he was categorical about saying that you should only get vaccine through that channel. So that information also I'm not so aware. But if a state government needs to get extra vaccines, they might have to also pass through the proper channel of getting vaccines into the country. Because you don't just get vaccines into the country, you need to get them through NAFDAC approval. And then, so it's not just like a vaccine you buy and start to use, because right now, most of all those vaccines do not have full regulatory bodies offering them the ability to use them. They are still under emergency use. So the whatever you apply for will be an emergency use. So that NAFDAC needs to regulate that properly. So it's not just easy to get in vaccines and use. So you must pass the proper channel of getting in a vaccine.
Is there a standard vaccine efficacy threshold, and should a lower level be a concern now?
Well, concerning threshold, that's a difficult question to answer, particularly for a disease which is barely a year. So you can't tell exactly how the efficacy of a vaccine will be now, because the disease is quite novel and new. So, but generally, considering ongoing studies, a vaccine with higher efficacy, I can't quote figures because the figures vary widely and vary depending on the persons who have had the vaccine. Because younger people might respond to a vaccine better than elderly people. So I can't pose the efficacy of 90 in a study done in younger people translates to an efficacy, that same efficacy in elderly persons. So usually an efficacy of up to 70 is good enough.
Okay, so what advice, as we wrap up this segment now, what advice do you have for members of the public as regards getting registered for the vaccines?
Yeah, I think for members of the public, elderly people above 65 should get the vaccine as much as possible, because they are the age group associated with more severe disease and death. And then healthcare workers should also get the vaccines. I would advise that they get the vaccines, because healthcare workers are always in contact with potential patients and could spread infections from one patient to the other. So it's good that they are vaccinated.
All right, Dr. Erameh, thank you so much for your time and expertise on the program.
Thank you too.
We appreciate you.
Yes.
I have been discussing the No False Compensation Program by the World Health Organization to address issues related to side effects as a result of the COVID-19 vaccines. Dr. Cyril Erameh has been giving us insights on that. Sound Health continues with trending health reports. Please stay tuned. It's still Sound Health on Lagos Television. More to come in a moment. This is all we have time for this week. Ensure you register online for the vaccines and stay safe always. For comments and inquiries, send SMS to 08035826603 or follow us on social media at LTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.